Hello, I'm Dr Charlotte Davies. I'm one of the doctors in the department here. I just wanted to speak to you about Daniel.
Yes.
I understand you're his relative, is that right?
That's right, I'm his grandmother.
You're his grandmother, and what
Yes.
was your name?
Erica.
Erica.
Yes.
And Daniel's 4 months, is that right?
That's right,
Just
yes.
to check we're talking about the right person.
Yes.
Yeah. And he's being looked after next door with my nursing colleagues, is that right?
Yes.
Yeah, okay. I just want to find out a bit of a understanding and a bit of background about what actually happened today. I know that you might not be sure either, but I'm just going to ask you a few questions to see if we can get to the bottom of what's happened. Is that
Yes.
okay?
Yes, that's fine.
Great. You brought Daniel here, and why did you bring him here? What did you notice?
When I got home, I'd done a night shift at the hospital, and when I got in, my partner was just leaving because he had to go to work, and he just said, "Oh, it needs changing." So I went upstairs, and I could see that he was upset, but sometimes he is when he needs changing. So I was changing his nappy, and then I noticed that his arm was swollen, and he wasn't moving it. He's normally, quite a wavy, smiley baby, so he definitely wasn't himself. And then, of course, seeing the swelling, I just thought, that doesn't look right. So I brought him here straight away. My daughter's on holiday, she's having a break because she's a single parent, so that's how it comes that me and my partner are looking after Daniel at the moment.
Okay, that's useful. And does your daughter know that you're here at the moment?
I haven't phoned her yet because I don't want to upset her,
Okay. And is it just you and your partner at home?
Yes, yes.
Just you.
Yeah.
And how's Daniel been otherwise? Is he a happy baby?
Yes, generally speaking, he's great. He's doing all the right things. He gets a bit colicky in the evening, and sometimes at night that bothers him, but then that's babies, isn't it? So it's not unusual, I don't think.
How long has he been with you? I know your daughter's away. Is it
Yes.
a long holiday, or has he just been with you a few days?
Just a few days. She's having like a long weekend break, so she's due back the day after tomorrow, but I probably we'll have to phone her once we know what.
Okay. And have you and your partner been coping okay with him? I know it can be a bit difficult when you're not used to a baby.
Well, I'm used to children, and that's all right. And I think my partner's been okay, but to be honest with you, it's quite a new relationship, so perhaps I made the wrong decision to go into work last night. They called me because they were short-staffed. There was a lot of people off sick, and I went in, and I'm regretting it really because.
Yeah. Okay. And obviously we don't know what's happened at the moment, but I think there's lots of questions that everybody's answering. If I just go back to Daniel, you mentioned he's normally quite happy.
Yes.
Any medical problems that he has?
No, not that
you're aware
of. No.
And any medical problems like osteogenesis or anything run in the family? I don't know if you've heard that word before.
Well, I'm assuming it's something to do with bones, I'm not that I'm aware of, no.
And he appears to be seeing things and following objects okay as far as you can tell.
Yes.
Has he had any injuries before? No, okay. And in terms of what Daniel's doing himself, is he starting to roll over yet, or not quite yet? It would be a bit early.
Yes, no, he likes waving toys, and he likes squeaky things and.
Okay, and you're obviously based here. Is your daughter local, or is she a bit further away?
She lives about 2 miles away.
About 2 miles, so the same council area essentially.
Yes.
Okay. So while I've been talking to you, my colleagues have got an X-ray which confirms that, as we suspected, there is a break in Daniel's arm, and the type of break that there is, it's very unlikely that he'll have broken it just spontaneously. So it looks like some sort of force has been applied to his arm. And it might be that there's something that we haven't found out about Daniel yet that makes him more likely to be those things. But I think we need to do a bit more investigating to try and get to the bottom of how this happened. I can see that you're already wanting to speak to your partner and that you're already having some questions for him. And I think we probably do need to speak to him. But for now, we definitely need to keep Daniel in the hospital overnight and maybe longer, both to keep him comfortable, but also to do a few more tests to find out what else might be going on. So we'll need to do a full examination and a full survey of all his bones and check there's no medical reason why this unexplained injury might have happened. We'll need to speak to the social services team, which is why I asked if your daughter was local, just to check that there's nothing else happening that we're unaware of. And if it does turn out that it is your partner that's been harming Daniel, we'll need to make sure we come up with a plan to keep Daniel safe and any other children safe. I know this is a lot to take in, and it's going to be something that's going to take a few days to sort out. But what questions did you have for me or us at the moment?
I'm just wondering what I should do, whether I should contact my daughter, I think.
I think your daughter would like to know.
Yes.
So I would contact your daughter and I would speak to your partner if you don't think it's going to cause you any danger, because it might be that there's something that he hasn't told you that would explain everything without us all needing to worry.
Yes.
But for now, you're going to have a million people will come and ask you the same questions that I've asked you. The paediatricians will come and speak to you, social services will come and speak to you, everyone will come and speak to you.
Yeah.
But yes, I think you should speak to your daughter and speak to your partner.
Right. Is Daniel okay now?
Yeah, Daniel's fine. We're giving him some pain relief and we're making him nice and comfortable and happy. You can come and see him in a minute,
Right.
but we'll make sure one of the nurses is there with you. Can I get you a cup of tea? Okay, thank you.
Yes.
Okay, I'll do that.